My name is Damián Borbosa. I'm a physician. I'm in 4th year of medical residence at Hospital Italiano de Buenos Aires, and I'm going to introduce you to the effectiveness of a chronic disease management system for blood pressure monitoring. In Argentina, like in many other countries, chronic conditions are the major causes of illness, disability, and death. Hypertension is a chronic condition, and it has a prevalence of 30% and increase with advanced ages, and is one of the most important modifiable risk factors for cardiovascular diseases. Information systems offer a number of benefits in healthcare, and there are different types of information tool or information system that can help to control chronic condition. There is a report of the California Healthcare Foundation that classifies the system in three categories: personal registries or disease registries, chronic disease management system, and electronic health records. Well, the Hospital Italiano de Buenos Aires is a university hospital with 750 beds and more than 2 million outpatient visits annually. We have also our HMO. It has 2 main hospitals, the ones that appear in the pictures, and 23 outpatient clinics. The HMO has 150,000 patients. The primary care is organized in a way that every patient has a primary care physician in charge of them. Every primary care used ambulatory EHR, and is there where they register the medical problems, which risk factors, comorbidities, and all these items are codified using SNOMED CT as terminology reference. In the year 2000, the HMO started a disease management program, and in the year 2005, it was developed a chronic disease management system to the support of the disease management program. The study is to show the efficacy of our surveillance system or chronic disease management system as a strategy for improving the performance of the hypertension care process. The outcomes. The outcomes were a patient with a chronic condition must have their blood pressure measured at least once every 6 months, and uncontrolled hypertension patient must have the measurement done every physician encounter. This is a metric from the Disease Management Association of America. So the main outcomes were the proportion of patients with at least one blood pressure measurement during the 3 months that the study, during of the study. Patient without blood pressure measurement in the last 6 months was the condition 1 that we studied, and the condition 2 were patients with a high blood pressure measurement in the last appointment. And then we had some secondary outcomes like mean systolic and diastolic. All the primary care physicians include were those that have more than 100 patients. Then patients without blood pressure registered seeking for an appointment on the following 15 days were randomized. Physicians were stratified in 3 categories according to the number of the appointment schedule, and they were stratified from 5 to 10 to 10 to from 10 to 15 and more than 15 appointments. According to their physician allocation number, it means 0, 1 in the randomization, patients were or were not enrolled in the surveillance system. Well, this is the intervention of the study. The intervention starts with, the intervention is the enroll of the patient in the intervention group in the surveillance system. And the intervention starts with the patient identification. The patient identification starts with the master patient index, where are all the patients in our institution. All the patients have an electronic medical record and a rule system. Take the data from the clinical data repository, from laboratory results or medication list, and choose from the problem list that are codified using SNOMED CT. Then the rule system run. It creates two surveillance lists, one for condition 1 and the other for the condition 2. These surveillance lists were daily matched with the appointment scheduling system to generate the surveillance list daily, so we can intervene the patient. So the intervention was the disease management program. Their assistance measure and record risk factors, blood pressure, weight and height, and then remind the patient verbally and